So anytime we introduce something new, there's always going to be pros, but we definitely need to talk to the patients about the cons. And when we discuss the different treatment options, we need to not only educate patients about the pros, but also, hey, here are the negatives that could occur. So when we talk surgical intervention, there's pros and cons. There's not a perfect solution. The perfect solution is that you grow and develop the way you're supposed to, and you don't have these issues. Too late for that. So what are some of the pros and cons? I've talked in great detail about the advantages of the appliance. Some of the negatives that we see, the number one thing that we see, we used to have, when we gave patients these appliances, we're changing the upper and lower, the relationship of the upper and lower jaw to help open the airway. And what we found is we had really great exponential improvement. They feel a little worse and then they exponentially improve and things are great. Well, what does our society think? More is better, right? So while we have them titrated right where they need to be, we used to give them the titratable advancement device in their kits to take them home. And we used to have a digital model where they would FaceTime, we'd take a look at it, see where they are, and save them a trip into the office. Well, now we keep the keys because this idea of more is better, they would advance themselves to the point that their bite would be messed up. So that's one thing we do. We keep them here in office to make sure they're not more is better, right? That's their fault that they were doing that, even though we educated them. Another very simple tool that we do is at night, essentially what we're doing is turning off all the muscles and turning the teeth off with the appliance. The appliance maintains the relationship of the upper and lower jaw. And by doing that, these muscles don't have to fire all night long to keep the tongue out. The patient can actually relax, fall asleep, and cycle through the sleep cycles in an undisturbed way. And by doing that, and the muscles deprogram, sometimes when they wake up in the morning, they feel so rested, they feel so good, their bite can feel slightly off. Well, yeah, it is slightly off. It's where you're technically supposed to be, but that's not where they function during the day. So we use an AM aligner, which is a very simple device. They put that in anywhere from 2 to 5 minutes, depending on the patient, and it reprograms those muscles. So before they have their morning cup of coffee, they're right where they need to be and moving forward. We evaluate their TMJ every single time they come in. Initially, when they get their appliance, we see them about once a month for about 3 to 4 months. Part of that is motivation and compliance, troubleshooting, etc. But we're checking the joint as well. We're making sure those muscles are where they're supposed to be, making sure they're using those AM aligners. And patients that use the AM aligners don't have any issues. It's the patients that don't make a priority of that sometimes can have some issues, and we have to refocus on that. After that, we see them at their hygiene visits every 4 months, 6 months, whatever recare program they're on. They bring their appliance in, we check the integrity, make sure everything looks good there, check their AM aligner, and we've been very happy with the TAP appliance because we don't have to remake it. I think we've had to remake one because the patient put it in the dishwasher to sterilize it and then used a power washer. So other than those types of things, we've been really pleased with the longevity of these appliances.